Hello, and thanks for joining us for this presentation on BadgerCare Plus premiums. I'm Bryn McBride of ABC for Health, one of the partners in the Wisconsin Coverage Connections project, a project that looks to connect children to health insurance coverage in western and northern Wisconsin. Who owes a premium under BadgerCare Plus? Generally, it's children and families where the household income is over 201% of the federal poverty level. That's the general cutoff. If you're a child in BadgerCare Plus, eligibility extends to 306% of the federal poverty level. Children in between 201 and 306 will be the children we look to first to determine if they owe a premium. Now, there are some other categories of adults that owe premiums: parents, step-parents, caretaker relatives. In a BadgerCare Plus income extension, that's kind of a carve-out of eligibility in BadgerCare Plus, where they're technically over 100% of the federal poverty level, but still eligible for BadgerCare Plus for a little bit longer. We have separate videos explaining BadgerCare Plus income extensions. And like any other rule, there are some exceptions to it, but we're going to go through just a couple of those. The people who will not owe a premium, these are the exceptions to premiums, are continuously eligible newborn. We have a separate video that explains the category of continuously eligible newborn. This is children from birth up through the 13th month of their life that if their mother was on BadgerCare Plus or Medicaid when they were delivered, they will not owe a premium for BadgerCare Plus. They will not have an income limit to BadgerCare Plus. The rules are a little bit different. It's designed to make sure that children born to women on Medicaid or BadgerCare Plus have a really healthy start at life, and therefore some of the rules have been waived. Some of those are the income requirements. There are a couple other rules that have been waived, and one additional rule is that they will not be asked to pay a premium if they are above 200%, 201% of the federal poverty level. Other people that won't owe a premium, another exception, pregnant women. Children that used to be in foster care that aged out of the foster care system. Children in a BadgerCare Plus extension, again, that income extension category we talked about. Adults under 100% of the federal poverty level will not have to pay a premium. And then there are a couple other variations on children, and they get a little bit more complicated based on the situation in the household. So if you have a situation where a child is being charged a premium, or you think maybe they should and they're not, that's a good instance to give us a call, and we'll look at the numbers and the categories of eligibility and determine if that's appropriate. How much are the premiums? Typically anywhere from $10 to $97.53 per month. It depends on the household income. If you're barely above that 201% FPL threshold for a child, you're looking at the smaller dollar amount for your premium. How do you pay? Direct payment, check or money order, electronic funds transfer. The state makes it quite easy to make sure that you're paying your premium. So there are a number of ways in which you can pay. If you're working with a family where they are having a hard time finding a payment method, we know some people don't have bank accounts or don't have checking accounts, that would be a good opportunity to give us a call as well, and we can talk through some best practices to make sure that that payment gets completed. This is handled in Chapter 19 of the BadgerCare Plus Eligibility Handbook. Now, you can also see more on applying for BadgerCare Plus at access.wisconsin.gov, and you can certainly give us a call when some of these situations get a little sticky. Before we let you go, though, we'd like you to take a little survey about questions on premiums in BadgerCare Plus. You can click on that pie chart icon you see at the bottom of your screen to do that. Thanks for joining us.